Functional anatomy of the adult lumbar spine. Weight bearing. The vertebral bodies and intervertebral discs bear over 80% of the static compressive load in erect posture. The progressive increase in the surface area of the vertebral end plates from C2 to the lower lumbar spine reflects the progressive increase in loading from above down. Vertebral body end surface area is maximal at L4. The end surface of L5 can be smaller because its forward tilt transfers a larger part of its load to the vertebral arches through T very thick pedicles and transverse processes that characterize L5. Except for the bony rim a few millimeters wide, each vertebral end plate is covered by a plate of hyaline cartilage about 1 millimeter thick. The outer fibrous annulus is attached to the bony rim and the inner fibrocartilaginous annulus is attached to the peripheral parts of the cartilage plate, forming an elliptical envelope for the incompressible fluid nucleus pulposus. The average height of adult male lumbar vertebral bodies is about 25 mm and the discs are from 10 to 12 mm thick at their centers. Their average antero-posterior diameter is from 30 to 35 mm. Their transverse dimensions increase from about 40 mm at L to about 50 mm at L5. Female vertebral dimensions are on average about 15% smaller. The girth of the column is dependent in part on the effect of muscular forces during growth, and the female vertebral column is more slender than the male column. Each vertebral body is kidney-shaped and covered by a thin shell of compact bone. Its internal body architecture reflects its weight-bearing function. A lateral X-ray shows the predominantly vertical orientation of its trabeculae, with cross ties, particularly numerous near the upper and lower end plates. The vertical bony trabeculae are quite rigid, but they can bend slightly when loaded. Unsupported vertical columns might bend beyond their elastic capacity and fracture, if they did not have the support of the transverse cross ties, which increase their rigidity. Red hemopoietic marrow fills the honeycombed interstices of this trabecular scaffolding.